Hi, Chris Duncan, independent insurance broker here again. And today's video is on an article from Philip Moeller of the PBS NewsHour, and it's about Medicare and observation care. And this is something Medicare beneficiaries should be aware of so they know the right questions to ask to avoid any unexpected medical bills. And the article is titled, How This Medicare Loophole Can Lead to Surprise Medical Bills. And I'll have a link to the article in the description of this video and also on our blog post as well. And this is a subject that we've long talked about to our clients. And if you're not admitted as an inpatient to the hospital for a minimum of 3 consecutive days, and this does not include the day that you're discharged from the hospital, you do not qualify for skilled nursing facility services under Original Medicare. Now, this means that Original Medicare will not pay for your skilled nursing facility stay, nor will any Medicare supplement you have purchased either. It gets even more confusing as well. You could be in the hospital and stay overnight and still not be considered an inpatient. You could be there as an outpatient, technically for observation care. This means that the doctor did not put in an order for you to be admitted as an inpatient to the hospital, but instead you are under observation care, and that can even continue over the night. This is something that definitely happens all the time, and you should be aware of the difference. Under the rules of Medicare, a beneficiary will not qualify to have a skilled nursing facility stay paid for by Original Medicare if they're not admitted as an inpatient, like I said, to the hospital for 3 consecutive days. And it's extremely important to remember that the day of discharge does not count as a day. And what can sometimes happen is someone might be admitted to the hospital for 3 consecutive days, but the first day might be under observation care. The beneficiary is obviously in the hospital overnight, and it's easy to think that they're officially admitted as an inpatient, but on page 28 of the official Medicare and You handbook, it clearly states staying overnight in a hospital doesn't always mean you're an inpatient. Your doctor must order your hospital admission, and the doctor must formally admit you for you to be an inpatient. If you are in the hospital for more than 24 hours, the hospital is required to give you a document called the Medicare Outpatient Observation Notice, aka MOON, M-O-O-N. But if you didn't know about this rule and were given this document, the beneficiary or family member responsible for making decisions wouldn't know it's an important document. A beneficiary may be in the hospital for the required 3 consecutive days, but maybe the first day was under observation care. And if they were discharged from the hospital on that 3rd day and required a skilled nursing facility stay subsequently, it would not be covered under Original Medicare. And I'm often asked, well, Chris, if I have a Medicare supplement, won't that cover the skilled nursing facility stay? And the answer is no. Because if Medicare doesn't approve the claim, no Medicare supplement is going to pay for the skilled nursing facility stay, no matter what plan you have or what company that you have. So now that we know when Medicare will and will not cover a skilled nursing facility stay, let's go into more details about this 3 consecutive days rule. Let's assume the beneficiary was admitted for 3 days as an inpatient and was not under any observation care. It is easiest to figure this out using the guideline of the midnight stay. The midnight stay guideline is not an official guideline of Medicare, but you'll see if you are an inpatient to the hospital for 3 midnights, this will satisfy the 3 consecutive day rule. For example, let's say you were admitted anywhere from 12:01 a.m. to 11:50 p.m. on a Monday. The 3 consecutive day clock is now ticking. Once you cross that first midnight, you've satisfied the first day no matter how long you were in the hospital. Now you know you have 2 more midnights to satisfy. To continue this example, you're in the hospital as an inpatient for the midnight on Tuesday to Wednesday, and this satisfies the 2nd day, and are still in the hospital as an inpatient on midnight from Wednesday to Thursday. Now we'll say you are discharged anywhere from 12:01 a.m. to 11:59 p.m. on Thursday. Remember, the day you are discharged does not count as your consecutive days, so we can't count Thursday as a day. But you can see you, the beneficiary, was in the hospital Monday, Tuesday, and Wednesday, 3 consecutive days. In my opinion, it is the easiest to keep track of this rule if you count how many midnights the beneficiary was in the hospital as an official inpatient. I am asked, why are hospitals not admitting patients as inpatients all the time if they're in the hospital overnight? And according to Dan Mangus, a leading Medicare trainer for Medicare agents in the United States, he says in his book published by Senior Marketing Specialists, Medicare contracts with private companies as recovery audit contractors, RACs. RACs audit a lot more than whether a patient stay is observational or an admission. Their incomes are linked to how much money their audit can recover, and the observational admission revenue differential has been seen as attractive for recovery efforts. To avoid these potentially costly RAC audits, hospitals and doctors began classifying more and more hospital visits as observational. Between 2006 and 2012, Medicare hospital visits were about flat, but observational visits rose nearly 90% to 1.8 million. Mr. Mangus cites the Medicare Payment Advisory Commission, also known as MedPAC, as his source and states the MedPAC advises Congress about Medicare. I have provided a link in the description of this video and also is available in our blog post posted on my website, trustedbenefitsdirect.com. In Moeller's article, he provides a real-world example of a Medicare beneficiary having a shoulder injury and requiring a 6-day hospital stay. And according to the article, the beneficiary was under observation care his entire 6-day stay. And as we know, a beneficiary must be admitted as an inpatient to the hospital for 3 consecutive days to have coverage for a skilled nursing facility stay. Let's talk a little bit more about skilled nursing facility and the details. Now, what part of Medicare pays for a skilled nursing facility pay, and what are the co-pays? Part A of Medicare is responsible for paying for inpatient coverage, and skilled nursing facility coverage is covered by Part A of Medicare. As we know, Medicare does not pay 100% of the bills. If the prerequisite of the 3 consecutive day stay as an inpatient has been satisfied, there is a coinsurance the Medicare beneficiary is responsible for. The total amount of coverage for benefit period is 100 days. If the beneficiary needs more than 100 days per benefit period, the beneficiary will be responsible for 100% of the costs past the 100th day. But fortunately, there is no coinsurance due for the first 20 days being in a skilled nursing facility. But the next 80 days, or days 21 through 100 of their covered stay, do have a coinsurance of $170.50 per day in 2019. And if the beneficiary maxes out the 100 days, that is a total of $13,640 the Medicare beneficiary is responsible for. This is one of the reasons why many Medicare beneficiaries decide to purchase a Medicare Supplement, also known as a Medigap plan, that can cover this coinsurance entirely. Now, not all Medicare Supplements or Medigap plans cover the skilled nursing facility coinsurance. So if you have any questions, please contact us and we'll provide you a list of all the Medicare Supplement programs available that do cover the skilled nursing facility coinsurance. Again, my name is Chris Duncan, independent insurance broker. If you found this info helpful, please do me a favor and click the thumbs up button. Leave me a comment about our video below or ask us any questions in the comments. We get back to all comments as quickly as we can. And also, please subscribe to our channel as well. This lets YouTube know that we're doing a good job putting out relevant information. Again, thank you for watching, and remember, all of our services are entirely free, and we can always be reached directly at 800-910-3382. Thanks again, and we'll talk with you soon.